medical, nursing, and psychosocial aspects. Retinitis pigmentosa RP. Number 1. Introduction. Retinitis pigmentosa RP is a group of rare inherited retinal degenerative disorders. It primarily affects the photoreceptors, rods and cones, and the retinal pigment epithelium, RPE. The disease usually starts with rod cell degeneration, leading to night blindness and progressive loss of peripheral vision. Later, cone cells degenerate, causing central vision loss and color blindness. RP is chronic, progressive, and irreversible, often leading to legal blindness by middle age. RP is considered a heterogeneous disorder because it can result from mutations in more than 60 genes, with varying inheritance patterns and clinical presentations. Despite being incurable, advances in gene therapy, retinal implants, and supportive care are improving outcomes. Number 2. Definition. Retinitis pigmentosa is defined as a group of hereditary progressive retinal dystrophies characterized by photoreceptor degeneration, pigmentary changes in the retina, narrowing of retinal vessels, and eventual vision loss. Number 3. Etymology. Retina, Latin rete, meaning net, referring to the net-like structure at the back of the eye. Itis, Greek suffix meaning inflammation, historically misused in RP since it is not inflammatory but degenerative. Pigmentosa, Latin for pigmented, describing the bone spicule-like pigmentation seen in retinal examination. Thus, retinitis pigmentosa literally means pigmented disease of the retina. Number 4, epidemiology. Prevalence, 1 in 3,500 to 5,000 people worldwide. Global burden, 2 million affected individuals. Inheritance. Autosomal dominant, 20 to 30% of cases, mild or later onset. Autosomal recessive, 50 to 60% of cases, moderate progression. X-linked, 10 to 15% of cases, most severe, affects males more. Onset, usually detected in childhood or adolescence. Complete blindness may occur by 40 to 60 years. Sex distribution, both sexes affected, though X-linked forms more severe in males. Pattern 5 types. A by inheritance, 1, autosomal dominant RP, 2, autosomal recessive RP, 3, X-linked RP. Pattern B by clinical form, 1, typical RP, symmetrical, night blindness, peripheral vision loss, bone spicule pigmentation. 2, atypical RP, asymmetric, localized or sectorial. Sector RP, pigment changes restricted to one quadrant. Pericentral RP, degeneration around the vascular arcades. C. Syndromic RP, Usher syndrome, RP with hearing loss. Bardet-Biedl syndrome, RP with obesity, polydactyly, kidney disease, learning disabilities. Refsum disease, RP with ataxia and neuropathy. Number 6, causes genetic mutations, 60 genes identified. Defective proteins involved in phototransduction, light signal processing, retinoid cycle, vitamin A metabolism, ciliary function, transport of molecules and photoreceptors. Examples, mutations in RHO rhodopsin gene, RP1, RPE65, USH2A, RPGR. 7 risk factors, family history, strong genetic link. Consanguinity, increases risk of autosomal recessive RP. Genetic mutations, carriers at risk of transmission. Associated syndromes, e.g. Usher, Bardet-Biedl. 8. Complications, complete blindness. Cataracts, posterior subcapsular. Cystoid macular edema, central vision impairment. Glaucoma, increased risk. Reduced independence, mobility issues. Mental health issues, depression, anxiety, social withdrawal. 9. Pathophysiology. 1. Initial defect. Genetic mutations alter structure, function of photoreceptor proteins. 2. Rod degeneration, impaired night vision, nyctalopia. 3. Progressive rod death, loss of peripheral vision. 4. Secondary cone death, central vision and color vision lost. 5. Retinal pigment epithelium, RPE dysfunction, pigment migration, bone spicule deposits. 6. Retinal vessels attenuate and optic disc becomes pale. 7. Visual field gradually constricts, tunnel vision. Number 10. Signs and symptoms. Early, night blindness, first symptom. Delayed dark adaptation. Intermediate, peripheral vision loss, difficulty navigating in dim environments. Advanced, tunnel vision, loss of central vision, reading, face recognition difficult. Photophobia, color vision loss. Associated signs, cataracts, macular edema. Number 11. Medical diagnosis. History, onset of night blindness, family history. Ophthalmic examination, fundoscopy, bone spicule pigmentation, attenuated vessels, waxy optic disc. Electroretinography, diminished absent rod and cone responses. Visual field testing, progressive constriction. Optical coherence tomography, OCT, retinal thinning, macular edema, fluorescein angiography, macular changes. Genetic testing confirms diagnosis and inheritance pattern. Now 12. Nursing diagnosis. Disturbed sensory perception, visual, related to photoreceptor degeneration. Risk for injury related to visual impairment. Social isolation related to loss of vision. Anxiety and depression related to progressive blindness. Deficient knowledge regarding disease progression and management. Number 13. Medical management. No cure currently, only supportive. Vitamin A supplementation, 15,000 IU day, slows progression in some patients, but requires monitoring for hepatotoxicity. Carbonic anhydrase inhibitors, oral, topical, reduce macular edema. Omega-3 fatty acids, DHA fish oils, may slow progression. Cataract surgery improves vision temporarily. Emerging therapies, gene therapy, e.g. voretigene neparvovec for RPE65 mutation, retinal prosthesis, e.g. Argus 2 bionic eye, stem cell therapy, experimental. Number 14. Nursing management, health education, explain disease course, genetic nature. Safety precautions, fall prevention, guiding in dark areas. Encourage use of low vision aids, magnifiers, screen readers, braille. Environmental adaptation, bright lighting, color contrast markings in home. Emotional support, counseling, reduce anxiety about blindness. Referral, vision rehabilitation centers. Genetic counseling for family planning. Number 15. Treatment options. Conservative, nutritional supplements, low vision aids, mobility training. Medical, vitamin A, acetazolamide, macular edema. Surgical, cataract removal, retinal prosthesis. Gene therapy, FDA-approved Luxturna for RPE65 mutation. Research experimental, stem cells, CRISPR-based gene editing. 16. Psychosocial interventions. Counseling to cope with progressive blindness. Support groups for patients and families. Occupational therapy to maintain independence. Special education for children with RP. Vocational rehabilitation for adults. Psychological care manage depression, anxiety, isolation. Number 17. Prevention. Primary prevention. Genetic counseling. Avoid consanguineous marriages. Secondary prevention. Screening at-risk individuals with family history. Tertiary prevention, slowing progression with vitamin A, omega-3s, early rehabilitation and visual aids. Number 18. Conclusion. Retinitis pigmentosa is a chronic, progressive, inherited retinal disorder causing gradual vision loss and blindness. Although incurable, advances in gene therapy, retinal implants, and experimental treatments offer hope. Until curative therapies become widely available, management focuses on slowing disease progression, preventing complications, providing rehabilitation, and offering psychosocial support. Early detection, patient education, and genetic counseling are vital to improve quality of life and reduce disease burden. Thank you. Have a nice day.